In this video, we're going to go over the base of the skull pain muscle and how to release it for instant relief. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to target the main muscles that cause the most amount of pain at the base of the skull. These muscles include the suboccipitals, upper trapezius, and levator scapula. What happens is a blend of weakness and tightness sets into these muscles, further leading to strain and eventual pain. So to make getting relief easy, we're going to focus on lengthening these tight muscles for quick pain relief and then focusing on strengthening them for long-lasting relief. A note about the exercises, each one works just a little bit differently. They're going to target different muscles. To get the best results, go through them all, use what gives you the most relief. With that being said, let's get started. So I'm going to do this all in one shot, so let's see if I can't mess it up. The first thing that I like to do is focus on releasing and lengthening the muscles that cause the most amount of pain in this area, which would be the suboccipitals, the muscles right at the base of the skull. So for this one, what we're going to do is take our fingers, interlock them like this, have our thumbs pointed towards the floor, and just place your hands right on the back of your head. What you want to do is stay off anything bony, including the spine and the skull. Only go over muscles. I like to go right off to the side of the spine, and then from there, apply enough pressure where it's going to be a comfortable self-massage, and then do circular motions with my thumbs. This usually feels really good, and if you have a lot of tension, headaches, this can offer quick relief. I like to go over one spot roughly about 5 to 10 seconds. Relax. If it feels pretty good, I just repeat this over the whole length of the skull, working towards my ears. When you do this, you're probably going to find that one certain spot just feels really tight and achy. Like for me, it's over towards the left right here. It's like a big muscle knot. At that point, treat it like your hot spot and keep repeating this over and over again until it's finally released or you're not getting any more improvement. And if you do have one spot that's just really tight and achy, it's just stubborn, what you can do to help release it is focus on different movements with your thumbs. So instead of doing a circular motion, take your thumb and go side to side, go up and down diagonally. The more movements that you use, the greater the odds will be that it will finally release. The nice thing with this method too is you don't always have to focus on the base of the skull. You can also do this over the middle part of the neck, towards the base of the neck, even into the shoulders. I would focus on everything because it's all interconnected. And if you find one spot that needs a little bit more attention, focus on it. But to take this one to the next level, what you can do is add in some more neck movements that will open it up a little bit more and allow you to dig into those muscles a little bit further. So if you have a lot of pain, like let's say it's a little bit more on the left side, what you want to do is turn your head towards the opposite side and then repeat. You're going to notice that you can just dig in there a little bit more. So give that a try towards the left, also towards the right. You can also do tilting motions, taking your ear towards your shoulder. Again, you'll notice it'll open up the other side a little bit more. If most of your tightness is right here at the base of the skull, what you can do to open up that area a little bit more is to take two fingers, put them right on your chin, and just do a slight head retraction. That is taking your head backward like this, and then tuck your chin towards your chest. As you do this, you're going to feel that area around the suboccipitals open up a little bit more so you can dig into those muscles to hopefully get some more relief. So afterwards, what I'd like to do is focus a little bit more on lengthening for more range of motion, especially pain-free range of motion. So for this one, we're going to take two fingers, put them right on our chin, and we're going to do that head retraction. But this time around, really focus on driving the back of your head backward like this as much as you can until you feel a really good stretch form in the neck. Once you feel that, you're going to hold this position and then take the hand on the other side, hook the back of your head, now push back and then hook and pull your chin like this towards your chest. As you do this, you're going to feel a great stretch form right here over the base of the skull into the suboccipital muscles. Hold this one comfortably for about 15 to 20 seconds, relax, and then repeat this about 3 to 5 times. And with each repetition, try to build into it just a little bit more. To take this one to the next level too, you can add in some more neck movements. So instead of keeping your head straight, turn your head a little bit towards one side, kind of like looking over your shoulder, and then repeat. You're going to notice it opens up the other side just a little bit more. So give that a try towards the left and then also towards the right. If any of those positions offer more relief, at that point, throw more repetitions in. So let's now move on to focusing on some more muscles that tend to cause pain right at the base of the skull. The first one that we're going to focus on is the upper trapezius, which is a big muscle that causes pain from the top of the shoulder into the side of the neck towards the back of the ear over the base of the skull. So there's a couple different ways to be able to stretch this muscle. This is my personal favorite. So whatever side that you're having the most amount of pain, let's say it's your right side, you take the arm on that side, bend your elbow at 90 degrees, and then slide it across your back as much as you can until you feel a light activation of the muscles right here on the top of the shoulder going into the neck. Once you feel that, you're going to hold that, take the hand on the other side, hook the side of your head, and now slowly pull your ear towards the other side shoulder. You'll feel a deep opening stretch from the side of the neck that works towards the back of the ear, and it usually feels pretty good. But if you would like a deeper stretch, what you can do is slowly turn your head like this to look upward towards the ceiling. But do this one slowly because it's going to grab into that muscle very quickly. So once you feel a deep, comfortable stretch, you're going to hold this for 15 to 20 seconds, relax, and then repeat this a couple more times. And I do recommend doing this on both sides to keep everything in balance. I know a lot of people will have shoulder issues and they won't be able to get into this position, so this is a different method to target the upper trapezius. What you're going to do this time around is shrug that side shoulder up, the painful side, as far as you can, and then hook and pull your ear towards the other side. Once you can't go any further, what you're going to do is then lower that shoulder down like this, almost like trying to reach and pick something up off the floor. You should feel that deep stretch form right into that muscle. So what I like to do now is focus on a muscle called the SEM, or the Sternocleidomastoid, which can cause pain right here behind the ear, the base of the skull, going forward like this over the front of the neck towards the collarbone. This one is pretty similar to the upper trapezius stretch. What we're going to do is just tilt our head towards the opposite side. So for this one, if you have a lot of right-sided pain, you just want to tilt your head towards the other side like this until you feel that gentle stretch right here in the neck. But this time around though, what we're going to do is drop our head backward. It's kind of like almost if your shoulder was a cliff, just trying to allow your ear to fall off that cliff like this. And as you do this, you're going to feel a deep stretch form right here at the base of the skull going down towards the collarbone, and it usually feels really good. To take this one to the next level, what you do is take the meaty portion of your palm right here on the other side and just gently press down on your collarbone, just straight down. And you'll notice that this will intensify that stretch quite a bit. So give that one a try and hold it for about 15 to 20 seconds for about 3 repetitions, and then just switch to the other side and repeat to keep everything in balance. So the last movement that we're going to focus on is with another muscle called the levator scapula. This one causes pain pretty much from the top of the shoulder blade all the way upward towards the back of the ear, towards the base of the skull. This one is fittingly called the armpit sniffer. So whatever side that you're having pain or discomfort, again, let's say it's your right side, what you're going to do is slowly turn your head in the opposite direction to look over your shoulder as much as you can. Once you can't go any further, what you're going to do is take the hand on the other side, hook the back of your head, and now slowly pull your chin towards your armpit like this. You should feel a deep stretch form, again, from the top of the shoulder blade into the side of the neck right here towards the base of the skull. You're going to hold this one comfortably for 15 to 20 seconds, relax, and then repeat this about 3 times. And then from there, just switch sides and repeat to keep everything in balance. Looks like I got through all of it without messing up. So let's switch gears and now focus on getting long-lasting pain relief by strengthening these muscles. Here's a really easy one that you can do daily right in bed. What we're going to do is start on our stomach and slide forward until our shoulders and head are off the edge. Let's begin by targeting the neck muscles. Take 2 fingers, put them right on your chin, and do a slight chin tuck until you feel a gentle stretch form in your neck. Once you feel that, you're going to hold this position and then just press the back of your head upward towards the ceiling as much as you can. If you struggle with this movement because of weakness, use your fingers right here to help you, but try to use pretty much your neck muscles only. Challenge them as much as you can, but you should feel a really good activation pretty much all throughout the neck, working towards the base of the skull. Hold this one comfortably for about 5 seconds and then relax, and then repeat this about 5 to 10 times. And with each repetition, try to build into it just a little bit more. If it feels like you have a little bit more energy, you're more than welcome to throw in another set or 2. So to take this one to the next level, you can add some more movements in, including rotation. So it's kind of like turning to look over one side, to look over one shoulder, and then pressing up like this. You're going to notice that it targets the muscles a little bit differently. So give that a try towards the right and also towards the left. If you notice any of those positions are more challenging, like it feels really weak, at that point, try to throw some more repetitions in. So the next thing that I'd like to do is focus a little bit more on the upper back because it is connected with neck pain. So we want everything strengthened. So this time around, what I'm going to do is get back into my original exercise, pressing the back of my head up as much as I can, holding that and then putting my arms out in front of me, kind of like in a Y position. I make fists and have a hitchhiker sign like this. What I'd like to do is kind of shrug upward with my shoulders as much as I can, and then I lift my fist upward towards the ceiling, trying to pinch my shoulder blades at the same time. You're going to feel a ton of muscles start to fire in the upper back that works towards the neck. Hold this one comfortably for 5 seconds and then relax. On the next repetition, try to build into it a little bit more and repeat this 5 to 10 times. But again, if it feels like you have a little bit more energy, try to throw in another set or 2. If the exercises help, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.